Avera has over 1,300 physicians, nurse practitioners, and physician's assistants. And about half of those are involved in the care of women and children.
When I started in healthcare, especially taking care of women, there was this kind of thought that the female physiology was the same as the male physiology. And what's really exciting about the times that we're in now is, first of all, we know that that's not true, but now our approaches to how we're treating diseases are different because of the female versus the male physiologies.
When the sisters started, that was the mission, right? Women's and children's care. It's the populations that didn't get a lot of attention. And if you go back to our mission, it's always about meeting the needs of the community, and always at the heart of a community would be the kids and the women who take care of them.
Women's health care can encompass everything from anticipating and wanting to start a family to obstetric care to delivery. So we have specialists from maternal fetal medicine to urogynecology that can help care for a woman throughout her entire adult life.
And then if you extend that even further down into peds, well, if you think of all the stuff you think for adults, you have to have a peds version of all of that.
Everything from a NICU, which is for our tiniest humans right after they've been born, all the way through to primary care, to pediatric subspecialty care.
Healthcare is incredibly complex. It is a living organism, and how we function in the living organism of healthcare impacts how we as clinicians make decisions, and that ultimately affects the care that's delivered to patients.
As we are expanding our services, it is just like the right time to bring us together, because I feel like together you're stronger than separate. The reality is women's and children's are tied because it's really a continuum of care.
Avera has 37 hospitals across a 72,000 square mile footprint, and that footprint is vast. So we are now building a women's and children's service line, and what that serves to do is to standardize care across our entire footprint.
For our communities to grow, we need to be able to provide great obstetrical care, newborn care, pediatric care in our small towns. Most of our population in the Avera footprint is rural, and so trying to provide that comprehensive care close to home, trying to provide care where people are is really what we're focusing on. I think that's a factor for a lot of people when they're deciding where to live, where to raise their family especially.
The challenges really come from the knowing what isn't available. So it's making sure that we have the safeguards in place in delivering medicine in a rural community that ensures that no matter what happens, we can stabilize, provide the care that's needed so that we're not compromising care.
He was the most beautiful baby I'd ever seen. Checking out all the fingers and toes and, those little things you do when you're getting to know a new little being. I got up to use the bathroom and passed a big clot. So I called the nurse real quick and hopped back in bed, and it was only a couple of minutes after that I felt another big one, and it felt massive. They immediately recognized that it was a postpartum hemorrhage. They were ready. They recognized it right away. They pushed the emergency button and the cavalry was coming. The nurse practitioner was on the phone with Sioux Falls and updating on the situation, bouncing off ideas, getting things going. And so they give the first round of meds. Nothing happens. They give the next round of meds. The third round, fourth, we've gone now through the whole set of medications you can give for postpartum hemorrhage. And it never dawned on me that I could be dying. Finally, they repeated the first medication and things started tightening up. And it was about that time that the flight crew got there.
If you're talking about obstetric care, the concern is always, are we in the right place for 4 hours from now? Our rural physicians have to do this evaluation all the time, and that's why I think the specialists are available by phone, because it is a conversation. As long as they're in kind of have the support of a specialist and whoever else they need, they can do quite a bit there and keep these families close to home. And if we try and do that, then the families trust us. They trust us, and when that doctor says, you know what, it's time to go. We've given all we have, and we need to do what's best for your kiddo, or we need to do what's best for mom right now, and make sure we get them to the right place.
OB happens especially fast, and a lot of times people don't have time to get to their target destination.
We're isolated, but we're not an island. We're not alone. We have a good network of integration of support, both in resources as well as with other people that have the expertise that's needed to have safe care. I would not practice in a rural area without that support.
And that is where the connectedness is so important. It allows us to stand shoulder to shoulder with each other across those miles and to provide the very best care regardless of location. Even when I am delivering a baby at 2 a.m. in Spirit Lake, I am just a phone call away from a NICU doctor. I'm just a phone call away from a maternal fetal medicine specialist. So that care is never far and it's always accessible to me.
I think we're a pioneer as far as rural health care. I think a lot of places, the general mechanism of action is to bring people into your big centers and your big cities. And I think at Avera, we're really trying to do a little bit of the opposite, where we're trying to provide the pinnacle of healthcare in all of our facilities, not just at our main centers.
That's really been the heart and the passion of our mission. And as we continue into the future, delivering healthcare across our 72,000 square mile footprint, across all of our hospitals, that has been core to who we are as a healthcare system and will continue to be into the future.